Hi, this is Daniel DiTuro. Do you believe one or more foods cause painful gas, bloating, and other symptoms? In this video, I'll share what is an elimination diet. Is it a low-carb diet? Some causes of gastrointestinal pain, the simple elimination diet, and extreme elimination diet. The goal of an elimination diet is identifying foods that cause painful gastrointestinal symptoms. Those symptoms include gas, bloating, nausea, diarrhea, constipation, stomach and bowel irritation, and GERD. Other symptoms are headaches and migraine, hives and itching, flu-like symptoms, fatigue, and difficulty concentrating. It can be as simple as eliminating one food, like milk or wheat, or as complex as eliminating a group of foods, like shellfish. It's primarily used to identify food intolerance rather than allergies. Your unique genetic code means there is no one-size-fits-all elimination diet. A food or foods that cause one person extreme abdominal pain or other symptoms causes no symptoms in another. Some low-carb diets eliminate many of the same foods or food groups, but for different reasons. Like humans are carnivores and should not eat plant foods, or that plant foods have deadly toxins, and plant foods have too many carbs. An elimination diet does not limit carbs. It tries to identify and eliminate carbs called FODMAPs. FODMAPs are undigested sugars that become food for gut bacteria. There are many causes of gastrointestinal pain and other symptoms. Some of the causes include food protein allergies, immune response, intolerance, fermentable sugars, and inflammatory bowel disease. Food protein allergens include common foods like milk, eggs, fish, tree nuts, peanuts, wheat, soybeans, and sesame. Symptoms can be mild, like tingling or itching sensation in the mouth, or severe, like difficulty breathing. Currently, the only option is eliminating the allergen from your diet. While gluten is a wheat protein, it's not the cause of wheat allergy. Gluten causes the body's immune system to attack and damage the small intestine. It causes malabsorption and other symptoms. Like allergens and immune disorders, intolerances, like lactose intolerance, requires eliminating the food with the sugar lactose. Lactose intolerance is so common, there are a variety of lactose-free dairy products. Lactose is not absorbed during digestion and becomes food for gut bacteria. Common symptoms include gas, bloating, diarrhea, stomach cramps, nausea, and sometimes vomiting. Lactose, a milk sugar, is a FODMAP. The goal of an elimination diet is identifying and eliminating or restricting FODMAP foods. Identifying troublesome FODMAPs can be a long, frustrating process. The simplest elimination diet is when your symptoms occur after eating one specific food. Gas, bloating, and nausea after eating dairy products indicates lactose intolerance. More severe symptoms, like difficulty breathing, indicates a serious food protein allergy. Identifying foods that cause symptoms is easier on diets of minimally processed foods with little or no synthetic additives. While additives like artificial colors and flavors are generally regarded as safe, some people have mild to severe reactions. The same with other additives like MSG. More chemical additives in your food increases the risk of an adverse reaction. Keeping a food diary can help isolate foods and symptoms. Another option is using your phone's camera to document your foods. Photographing foods simplifies tracking and symptoms, especially when dining out. Identifying troublesome foods can be a long process of trial and error. There are no accurate at-home tests for food intolerances. There are blood tests for celiac disease, and in some states, you do not need a doctor's order. There are skin pricking tests for food allergies. Finding IBS and intolerance triggers is more complex. For example, the broccoli, onion, and green bell pepper are high FODMAP foods. That does not mean everyone will have the same symptoms or any symptoms eating these foods. To isolate the culprit, all 3 ingredients must be eliminated and be symptom-free for a week. Broccoli is a cruciferous vegetable. Broccoli and other cruciferous vegetables are high FODMAP foods. A low-carb fad diet would simply eliminate all these foods. Using the elimination diet, you may find your symptoms are caused by onions, not broccoli. When you eliminate an entire group of foods, you also eliminate beneficial nutrients. In addition to vitamins and minerals, these nutrients are antibiotic, anti-cancer, antioxidant, and anti-inflammatory. The more foods you eliminate, the higher your risk of developing vitamin and mineral deficiencies. It can take 2 to 4 weeks on an extreme elimination diet to see any improvement in your symptoms. If you are symptom-free, you can slowly add back foods every 3 to 7 days. It can take 3 or more days to be sure you're still symptom-free. Depending on the severity of your symptoms, you can decide whether or not to reintroduce a food or foods. You may find homemade breads and rolls produce no symptoms, while restaurant and store-bought bread products produce symptoms. Most restaurant and store-bought breads and rolls have ingredients not used in homemade breads. Plain fried potatoes may produce no symptoms, while seasoned fried potatoes causes symptoms. The cause is usually not herbs and spices, but high FODMAP ingredients like wheat flour or chemical additives. The takeaway from this video is that an elimination diet can be simple or complex, depending on your symptoms and the number of foods causing your symptoms. Please leave a comment if you have any questions about this video. Thank you for watching and healthy eating.